I'm Elizabeth Shepherd. I'm Professor of Archives and Records Management in the Department of Information Studies here at UCL. So my research focuses on archives and records management, and particularly on the professional involvement in record keeping, and that's been a long-standing interest in research. But gradually over the years it's become apparent that whilst bureaucratic organisations are quite good at documenting themselves and their regulatory obligations, perhaps what's not so well represented in the record are the people that the records are about. So we designed a research project to look at the record-keeping needs and wants of care-experienced people. So that's adults who are in out-of-home care as children. And we knew quite a lot about the bureaucratic organisations, the charities, the local authorities that look after children in out-of-home care settings. But what we didn't know so much about was what was actually in the care records. So the parent, the corporate parent, creates a care file, a record of all the interactions, social work, teachers, medical and so on, with the child in care. We wanted to work with care leavers, so we worked with the Care Leavers Association to design a piece of research that would really try to take into account the perspectives of care-experienced adults and try to reflect their experience of trying to access their records from their childhoods. And the most important thing I think about the research is that we worked in a participatory and collaborative fashion with care-experienced adults who we work with as co-researchers, and they helped us at every stage of the research project. So they helped us to design it, they helped us with the data collection, and most of all they helped us to understand what we were finding in the analysis. And to get their voices and views really central and put aside, to some extent, the more professional record-keeping views which we were already more familiar with. We believe that the findings particularly apply in England, but the practice findings and the ideas of putting human voices, particularly in this case care-experienced children, voices into the file in a more systematic way, that's of international interest. And in fact we have worked with colleagues in Australia who've done some similar work with care-experienced adults looking at how their voices are represented in the files. So there's a kind of network now of researchers working with care-experienced adults looking at similar questions in a number of countries around the world. So I think it will have some international significance as well.